Hello, social media. It's your nurse practitioner, Katina Kennedy, here with some more health tips. I'm just going to ramble whatever comes to mind. I'm going to talk about today. I never have anything on my mind in particular. Well, sometimes I do. But just starting off, I get a lot of questions from my female patients about bacterial vaginosis, which is a common vaginal infection that we as women may get. It can be reoccurrent. You can treat it and then it comes back. The reason for this is, and bacterial vaginosis is just the overgrowth of the bad bacteria versus the good. And some of the symptoms you may get is fishy odor, increased watery discharge. Sometimes it can be milky as well. Your period may be irregular. That sometimes if you have like spotting in between your periods, that can be the reason why you may have a vaginal infection. So I tell persons who ask me, why am I having irregular periods? Sometimes you have pain as well. But those are some symptoms of a vaginal infection. So bacterial vaginosis, yeast infection, these can become recurrent for a number of things. And a main reason why is because the pH is off, the vaginal temperature. Whenever that pH is off, you don't have that normalized temperature of the vagina, that causes things to grow within it. So a couple things that causes that: you have your fragrances, any scented products you should not be using down there. That always changes our pH, also known as temperature. So using scented materials or scented items, that's your scented tampons, your maxi pads, your body washes, your soaps. You have to stay away from scented items, because if not, I can treat you for the bacterial vaginosis. But guess what? If you're still doing those same things, it can come back again. So staying away from scented products. Also, if you have frequent sex and your partner ejaculates inside of you, guess what? This can cause the reoccurrence of this bacteria, because the semen causes the vagina pH to become off. So it's very important that if you do have frequent sex, sometimes have your partner to ejaculate on the outside of you and so forth. So that can be another cause as well. A lot of my married couples are like, well, what am I supposed to do? Well, that's up to you to come up with creative ways. If you have sex all the time, from him not ejaculating inside of you so much. So that's another cause. So your scented products, the ejaculation inside, are some things that can cause the overgrowth of the bad bacteria. Also, hormones. Sometimes when some patients take hormones, sometimes birth control pills can, maybe not sometimes. But those are like the two common things. Just the scented products. I always educate my patients, stay away from the scented products and the just anything that will alter the environment of the pH. And that would cause the overgrowth of the bacteria. So some things that can to prevent that would be to those things that I just mentioned. And then as well, probiotic. Acidophilus is just a natural probiotic that helps just keep the vaginal environment in a stable condition, preventing those things from occurring. So that's just a brief synopsis regarding bacterial vaginosis, yeast infection, just ways on helping maintain. Dove unscented sensitive skin bar soap is an excellent soap. It's not scented. If you do your natural, I don't know so many natural ways, so I can just educate you on my things that I know about. However, if you know any natural soaps, you can use those as well. But I'm just all about staying away from unscented products. Men, I want you to start doing your self-testicular exam. This is very important. Testicular cancer is the number one cancer between the ages of 15 and 35. We do see a higher incidence of testicular cancer in our Caucasian males. However, guess what? It can happen in any males. I want you to, if you don't know how to do it, you can maybe YouTube it. They can show you how to perform your self-testicular exam. I'll maybe do it in another video for you all. But once a month, you want to make the conscious effort to check your testicles and make sure you just check the scrotum to make sure you just have your two testes there, your two hard balls. And then you'll feel around in the sac and you'll feel your veins that's normally there, but you want to make sure that you do not feel any other lumps as you do those two testes, also known as your two balls, that's present. So I want you to start doing that, because preventative care is key. You have to be familiar with yourself so that you can recognize if there's anything different within your body. Same thing with my females. Check your breasts once a month, 2 weeks after your period. It's the best way to do it. You do it before, the breasts are tender, the breasts are lumpier. You will or may find lumps in your breast. So we tell patients stay away from your breast during that time. Last tip for the day, and I can go on and on and on, but I don't want to keep you too long. But last tip, let's talk about heartburn or stomach issues, gastritis. This is inflammation basically of the intestinal area. This is caused by spicy foods, greasy foods, caffeine, alcohol, marinara sauce, and it may not be all for you, but you have to figure out what's causing this increased acid in the stomach. When you cause that increased acid, that may be your problem. That could be why you're having the bloating, the nausea, the feeling full earlier, sometimes abdominal cramping, increased gas, and so forth. So if you're having those issues, just trying to pinpoint what may be the cause for you and staying away from that. And also, again, we go back to that probiotics, that good bacteria into the intestinal area. So if you ingest those once a day, that may help with your issues as well. But of course, at any times it becomes consistent, you want to make sure that you consult with your healthcare provider or me. Come on in and see me, and we'll examine further and go from there. Because the reason why you have to treat this increased acid, because if you don't, it definitely can turn into more serious conditions such as Barrett's esophagitis, which is chronic inflammation, and that can eventually turn into cancer. Not treating the increased acid can also cause ulcers. So again, you don't want to ignore any type of continuous heartburn. You don't want to ignore any type of continuous issues regarding your intestinal tract. Also, skipping your meals. When you skip your meals, that definitely causes you to have these GI symptoms. So when you skip your meals, remember our stomach pump normally produces acid. So when you skip your meals, the stomach pump produces acid because it tears away, because it's breaking down the food. That's what it does. So when you're not eating, guess what? Your stomach is still pumping acid. And if it has no food to break down because you are skipping your meals, it's tearing away at the lining of your stomach. And that's causing more inflammation. And that's why you get your symptoms that you have. So again, you have to continuously feed your body, healthy foods at a regular, like every 3 to 4 hours. And that'll help with your metabolism as well. So I'm going to stop there. Again, I could go on and on. Again, I'm here for you if you have any questions for me. And I'll see you next time. Nurse practitioner, Katina Kennedy. Have a nice day.